Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? Huh? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors. The number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako, ganun.
We're always with you from start to healing. Magandang araw po sa inyong lahat. Ako po si Sheila, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa ating pong mga manunood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yung naubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung ano ko. May dugo na yung plema ko. Di pina-x-ray nila ako. Mayroon ng findings na mayroon bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita ang bukol sa sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na akong nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga sa mayroon akong lungs cancer, stage 3C. Ayaw ko kasi nagpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank, malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR, pagbalik ko, salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARS. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mga mahigit ng 1 buwan, Maganda dahil yung dugo ng plema ko nawala doon sa PPARS liquid. Nawala yung dugo. Hanggat sa ma-biopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, magaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARS dun sa GPT po, no, yung targeted therapy po, na nasabi ninyo kayo. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARS liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng gefitinib, ang bilis lang. 4 na beses lang akong nakainom, nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARS is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na pre-prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po, no, ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARS. So, I think ganun po yung nangyari po sa inyo. No?
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARS liquid saka PPARS ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo, hindi na ako nahingal, hindi na ako nag-o-oxygen.
After po nun, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARS?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention na pampalakas din ng resistensya. Hanggang ngayon, nagiinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, no, o bukol sa leeg, ay nawala.
Nung nainom na ako nung gefitinib, yung mga bukol dito na nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ako, ang liig ko nawala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARS kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya na inom ng binibilhan naman ako ng mga anak ko ng mga daming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARS. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARS nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas na sa CT scan ninyo? Netong January po.
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung parang naging resulta po, no? Nung pag-combine po ninyo ng PPARS at saka po ng GPT po, no? This past months po. Ano po yung mensahe na pwede nyo pong maibahagi sa kanila sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayo mawala ng pag-asa. Ang cancer, nagagamot. May Simply Nature, may PPARS, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako ng todo, gusto ko uminom kaagad, kaso lang kaiinom ko lang. Dahil yun ang maginhawa sa pakiramdam ko na pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po no, sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Hi, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simply Nature's PPARS liquid at PPARS tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simply Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung ano yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing.
Good evening, everyone. My name is Jhen a board-certified pharmacist and your health advisor here in Simply Nature. Welcome to another episode powered by SMG or Simply Healed Medical Group. Last week, Thursday, that is May 2, we discussed about, who can remember? Who among of you attended? Yes, that's right. We discussed about preventing cancer from coming back. That very informative session delved into understanding the causative factors, dietary habits, and lifestyle choices, and latest advancement in survivorship care. So for those of you who missed it, just replay on our YouTube channel, search for Simply Nature, and don't forget to subscribe while you're at it. Moving on tonight, we are going to discover the most effective way to detect cancer using imaging scans. So whether you are newly diagnosed, already ongoing treatment, survivor, a caregiver, or simply interested in promoting health and wellness, this free webinar is for you. So please tag and share with your family and friends. To give more insights, of course, we have a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore. You all know him. It's no other than Mr. Shyan Lim.
Hi, Jen. Hi, everyone. Good evening, everybody. Today's topic is really interesting. It's about imaging modalities for cancer detection. Now, to all our viewers, I'm sure one of the things we all try to avoid is to spend money on diagnostics, right? Sometimes if the doctor says, you do a scan, the first thing that goes in our mind is, doc, how much? So that's something that we always want to understand. Why do we really need to do the imaging? And many times also, what is the doctor trying to achieve with the imaging? Well, Dr. Jansen is going to discuss that. And after the discussion, if you have further questions on how to use imaging or any questions about health at all, do stay and join us on our Ask Me Anything segment. So I'll see you, all of you, in about 20 minutes. The discussion is about 20 minutes. So I'll see you then. Jen, I'll hand the time back to you to introduce Dr. Jansen for the discussion.
Yes, thank you, sir. So we also have Dr. Jansen Kalalan, who graduated from St. Luke's Medical Center College of Medicine, then was conferred as a diplomat of not only the Philippine College, but also the International Board of Lifestyle Medicine. He is also a medical consultant at SMG or Simply Healed Medical Group and at Alta Integrative Medicine Wellness Complex in Perpetual Health Medical Center, Las Piñas. Let's all watch this.
Why do doctors request for these scans? So, number one is, of course, for us to know the size and the location of the tumor. And another one, if it's going to influence our management of your case. If you want to go all natural, go for the therapeutic dose, right? So if you're already going on a therapeutic dose, and most of the time, these natural therapies don't really have much side effects. So the risk actually of taking these supplements and natural food is really low, right? So if you are already on a cancer protocol with this, then it's not really necessary to do the scan anymore.
Hello, everybody. Welcome to another episode of Simply Healed. And today we have our Dr. Jansen with us.
Hi, glad to be here again.
Yeah, today we're going to be very excited. Doc, I have very good questions for you that I think our viewers are very interested in, which is diagnostics, scans. What kind of scans do we need for cancer patients? You know, we have those CT scans, MRI scans, and these scans can be so expensive. So Doc, today we would like you to enlighten us. Okay, for a cancer patient, what kind of scans are necessary? You know, I really realized this,
Yeah, okay. So, the scans that we have right now, the imaging tools that we have right now for cancer are ultrasound, X-rays, CT scan, MRI, PET scan, and the nuclear imaging tools. Okay, so we have a lot of tools that we use. So each functions differently, but the basic principle is almost the same. It's to take a look inside your body so that we know the size of the tumor and the location of the tumor. Okay? So, let's go to the basic stuff first. Ultrasound.
Ultrasound.
Okay. So, ultrasound uses sound waves, basically, to know, it acts like a sort of a sonar.
Okay? So in order to locate the tumor, the size of the tumor.
Is it expensive, ultrasound?
No. Ultrasound is not really super expensive. It's fairly cheap, but of course,
It's like 1,000 plus, right? Or
yeah, it's 1,000 plus. It ranges from 1,000 to 5,000.
Okay.
Depending on the institution where you are going to do the ultrasound, no? So basically, what we see inside the ultrasound, if we are looking at a tumor, if the tumor is if the mass is solid or liquid inside.
Oh.
If the mass is solid, then it comes out as a
Black.
hyperechoic.
Oh, okay.
Hyperechoic. So it sort of like a gray
Gray.
image in the ultrasound.
Mm.
If inside the mass it is water, then it returns as a black circle.
So what
on
is
the
good?
ultrasound.
You want it to be black or you want it to be gray?
Okay, you want it to be black because
want it
black,
to be black,
is if it is black, then it is probably benign.
Oh, wow.
Okay, if it is solid or in medical terms hyperechoic, then that is more of a malignant character. But of course, to know really for sure if it's malignant or not, then we have to take we have to do a biopsy.
All right.
Okay.
What's the next diagnostic?
Okay.
X-rays, right?
So, okay, X-rays are light, no? It's an electromagnetic wave that shoots through your body. Okay, so these X-rays are exposed to a film. So in that film, you will see white and black stuff. Okay, so usually, if the X-ray passed through a solid object, or if it is attenuated much greater, then it is usually turns out white on the film.
Okay.
So these structures include bones, blood vessels. Okay, so those are the usual.
So for X-rays, if you have a tumor, what is good, what is bad?
Okay, we're looking at a tumor
Yeah.
using an X-ray. What is bad is solid white. Okay? Circular solid whites. Okay? So that is a character for a bad prognosis.
So black is good again.
Yeah. Why is black good? Because black is usually either water or air. Okay?
Wow.
Because air and water does not inhibit X-ray too much.
Okay. X-rays are expensive?
No, X-ray is one of the cheapest
How much is
imaging. It ranges from 500 peso,
500
even as cheap
pesos.
as
So
300 to
Wow.
1,000.
So 300 plus to 500, maximum 1,000.
Yeah.
For ultrasound, it's 1,000 to 5,000.
Yeah. So
what's next?
okay. So the next imaging modality we have is a much expensive X-ray, which is the CT scan.
Oh, CT
Okay,
scan.
so-
I keep hearing that for cancer patients. They have to go for CT
Yeah.
scan.
Okay. So CT scans have a higher accuracy than X-rays.
Okay.
And the good thing for CT scan is that you can do 3D remodeling. So you know where the tumor is located exactly, and you can do some measurements.
Wow.
Okay. So that is the plain CT scan.
So cancer is always, if a suspected cancer, then most of the time it's a CT scan, right?
Yeah, usually, but it depends on where the tumor is actually. Okay, so for brain tumors, or if your doctor is suspecting a brain tumor, usually an MRI makes more sense.
MRI. So how much is a CT scan first?
A CT scan costs around 25,000 to 40,000.
25,000 to 40,000. Okay,
Yeah.
I know what you guys are feeling out there now, and I will ask Doc Jansen that important question. All right, which I know what you're asking is, Doc, do I really need the CT scan because it's 40,000 pesos? But we will get to that after we finish with the other ways of scanning. So MRI, what is MRI?
Okay, so MRI uses magnets.
Okay.
Okay, so basically how it works is that it aligns your water molecules together so that it produces a sensible picture.
Wow, that's
of the inside of your body. So it's really high tech.
That's more science than I understand already.
Now, the difference between CT scan and MRI is that MRI produces a much more accurate picture inside your body. And unlike CT scan, because CT scan is a glorified X-ray machine, no?
Okay.
So CT scan has you get exposed to the radiation. But in MRI, you don't. It doesn't have any side effects whatsoever.
Wow.
So an MRI makes more sense in a way since it produces a more accurate picture.
So MRI scan is always better than a CT scan?
Not always. It depends on what you are looking at.
Okay.
Yeah.
So how much is an MRI scan?
An MRI scan is significantly much more expensive to the CT scan, but it's fairly close. It can cost you around 30,000 to 40,000, depending on how big is the scanned area. Okay.
Okay.
So
we have we've gone through the first 4 already. Next is contrast imaging.
Yeah.
What is contrast imaging?
Contrast imaging is basically the medical staff injecting a dye inside your body so that this dye, when it goes to the tumor, it lights up like a bulb. Okay, so the principle behind this is that every malignant tumor has its own blood supply, right? From our previous show, we talked about it. Yeah, if you missed it,
watch on YouTube.
Yeah,
we have it
right.
on YouTube.
Okay, so basically, yeah, a tumor has its own blood supply. A malignant tumor has its own blood supply, so that when the dye is injected into you, that dye goes into the tumor, so that once they scan it, it shows up on the scan. So that's when they know, hey, we are looking possibly a malignant tumor.
So how much is a contrast imaging?
Okay, a contrast imaging is significantly much more expensive than the plain CT scan or the plain MRI. Okay, so it can cost you around 40 to 50,000.
40 to 50,000.
Depending again on what institution you had it done and the location.
And we're just going to go higher and higher, right?
Yeah.
Because the next one is a PET scan.
Yeah.
Again, that's something we keep hearing. If you're a cancer patient, your doctor will ask you to go for a PET scan.
Hi guys! Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. Okay, so a PET scan is a positron emission tomography scan.
Now you know what it stands for.
Okay.
All right.
If you do not know what a positron emission tomography, just Google it. So a positron is basically an antimatter of an electron. So that is the principle behind a PET scan. And the good thing with PET scan is that we uses glucose as a contrast. So remember, from our previous videos, we took a look, we investigated about sugar feeding on cancer cells. Okay, so now, here is when we take advantage of that phenomenon. So we know cancer cells are highly metabolic. So if they are highly...
They take a lot of sugar.
Yeah, they take in a lot of sugar. So if you undergo a PET scan, your areas of the body which are high in metabolism will light up. Okay? But, of course, having just a PET scan will not really work because we have a lot of highly metabolic organs in our body. Our brain, our liver are really highly metabolic. Our kidneys, that is where the contrast gets excreted. So that will normally light up as well, even your urinary bladder. Okay, so in order for a PET scan to make sense, it has to be correlated with a CT scan.
Also, you have to do both a PET scan and a CT scan to compare.
Yeah, so what you can find in the hospitals and the clinics nowadays is a combination of both. It's a PET, CT scan. So why do we need to combine PET scan and CT scan? So the CT scan tells us the space, the anatomy.
Okay.
Where the tumor is located and what the size of the tumor is. A PET scan tells us its function or the physiology. So if that tumor is highly metabolic, then it probably is cancer.
Cancer.
Yeah. If it does not light up on a PET scan, then it is not metabolic. So it's probably a benign tumor.
So if you've done a PET scan already, then you will know whether your tumor is benign or a cancer tumor. So the next time you want to check the size of the tumor, you don't have to do the PET scan anymore. Just a CT scan.
Just a CT scan.
Oh, wow. Okay.
Okay, so another use. So doctors use PET CT scan in what? Of course, it's going to be very expensive. So
How much is a PET CT
a
scan?
PET CT scan nowadays costs around 70,000 to 80,000.
70,000 to 80,000.
Yeah,
Wow.
so
okay.
that is the range. Okay, so we know that it's really very expensive. So doctors only use it if we are suspecting metastasis, and we want to locate where that metastasis is.
Okay, all right.
Yeah.
And last but not least is nuclear imaging.
Okay, so nuclear imaging, there are a lot of nuclear imaging modalities that we have, but I'm not going to go into one by one because there are a lot. So nuclear imaging basically is the medical team gives you a radioactive drink. You
Okay.
drink it.
You drink it,
Yeah.
like the Hulk.
Yeah.
You drink some radioactive
Drink-
stuff.
Yeah,
in
but
your body.
you won't get some mutations. Okay, so
Okay.
it's entirely safe.
Alright.
The amount of radiation that they give you is really very
Very
low.
low.
It's really very low. Okay, so when you drink it, that specific radionuclide attaches to the tumor or to the organ that we are trying to monitor. Okay, so once that lights up in the scan, then we know that hey, this is probably a
Cancer.
metastasis or cancer.
So how much is a nuclear imaging?
Nuclear imaging costs cheaper.
Okay.
It can cost you around 15 to 20,000. It may actually, depending on the radionuclide they used, it can jack up to 30,000.
Wow. Okay, Doc, let's go to the really important questions that I think our viewers will want to know is, number one, Doc, do I really need to go for a scan? If I do have enough money, is it good to go for scan?
Okay, so before I answer that question,
Okay.
why do doctors request for these scans? Okay, so number one is, of course, for us to know the size and the location of the tumor. And another one, if it's going to influence our management of your case. Okay, is it going to, once I have this scan, is it going to influence my management? Once I have this scan, am I going to do surgery on you? If I have this scan, am I going to prescribe chemotherapy? Of course, those procedures have a lot of risk. So the scan should be justified. Okay?
Oh, so a scan, we because number one, right, guys, we all know that, I mean, for a lot of patients, especially cancer patients, I think the biggest worry when a person gets cancer is, apart from you don't want to, how long we have, is how much is this going to cost me and my family? And I know the first thing that we want to do when we meet so many cancer patients is that how can we reduce the entire treatment cost of cancer? So we always ask this question, do I really need to go to a scan? So Dr. Jansen has clearly shown us the scan is necessary when there's a decision needs to be made to any change in the way the doctor is going to treat you. Doc, before we explore this further, I just want to ask one simple question. Because a lot of these scans use radiation. So apart from the MRI, which has no radiation, the rest I think all do. Is there a limit how often you can do a CT scan? Well, if I do many of these scans, for example, if you do have the finances, you do have the money, it's not a problem. If I do a lot of CT scans, is there a health risk at all?
Yeah, of course, because CT scan uses X-rays. And as you all know, X-ray can cause cancer. It's a carcinogen.
Wow, okay. So even if you have all the money in the world, you want to limit the amount of CT scans that you do. Basically, you do it when you reach a decision point if the doctor's going to change his treatment. He just needs clarity, like surgery. You need to know where the tumor is so that you know where to cut. And you need to know whether you have to up your chemotherapy because the cancer may have spread and metastasized to other places. Doc, then there's a very interesting question. Doc, I know that you always share with our audience a balanced treatment. That means you always encourage them to work with the oncologist as well. But it's also true that there are a growing number of patients for their own personal reasons and beliefs. Maybe it's because of finances, maybe it's really because of their experience. They had other family members who went for chemotherapy, and for whatever reasons they want to go all natural.
Yeah.
Or like my dad. My dad is a 2-time cancer survivor. The first time he went for radiation therapy. The last time was about 2 years ago, just before the pandemic. I actually asked my dad, I said, Dad, if you go and test and it's really cancer, what do you want us to do as your children? I said, if you want us to spend all the money on the chemo or whatever, we are prepared, but we just want to know what you want us to do. And he actually told us, this time around, he said, son, the best days of my life are in the past.
Yeah.
So my dad is 74 years old, so he actually told us, no, if it's really cancer this time around, he just wants to go natural. I say, yeah, if it's his time, his time. So, okay, so for whatever reasons, if the patient decides, I want to go completely natural, no matter how bad my cancer is become, I have my own personal reasons why I don't want to go for surgery or chemotherapy, then in that case, are all these scans necessary?
If you want to know, if you just want to know the size, so then you can go for the scan. But if you want to know the answer to the question, am I getting better, right? Am I responding to treatment? Well, the scan is really not necessary because. Hi guys. Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. If you want to go all natural, then these natural therapies, go for the therapeutic dose, right? So if you're already going on a therapeutic dose, and most of the time, these natural therapies don't really have much side effect like the chemotherapies, right? Because, you only get side effects if you're taking in herbs. But for food, supplements, they don't really have really significant side effects. So the risk actually of taking these these supplements and natural food is really low, right? So go for if you are already on a cancer protocol with this, then it's not really necessary to do the scan anymore.
Yeah, because so from what I understand today is this. We go for a CT scan so that we know how to control dosage.
Yeah.
Because chemotherapy and other and surgeries, you have to know where the tumor is. So since you're not going for surgery, you don't need to know where the tumor is.
Yeah.
And since you're not going to go for chemotherapy, then you don't need to worry about the dosage. So you just want to use whatever protocol. If you're eating organic carrots, eat as much organic carrots as you can. You can actually save your money because the scan will not
change the way what you're doing now.
Right? But for an oncologist, it's different. They need to know the PET scan so that they know to control or change your dosage.
Yeah, if they're going to increase the dose, so they need to establish that
a reason to increase the dose.
A reason to give you chemotherapy or increase the dose, right? So if your PET scan showed a metastasis, then that's the time. But if your PET scan just showed what? An inflammation or a joint inflammation, then of course that's easily managed by a pain reliever.
Just a pain reliever.
Yeah, they're not gonna put you on a chemotherapy just on that assumption that it is a metastasis, whereas it's not, right?
So that's really good news. I think doc, really for me, I've met so many patients, and many times even me, I wanted to advise them to go and get a scan. But every time I mention a scan, the patient's face changes. They're like, I can see sweat coming out their eyebrow, and they're just thinking to me. But then they don't tell me. But I know what they're thinking. They're like, Can I don't spend the money for the scan? And today, doc, you really helped me a lot. So for all the patients out there, this was very helpful to me. I realize now that if you are committed to all natural, you don't actually need the scan because it's not going to change what you do. Because if you are living a healthy lifestyle, the best thing that you can do is live a healthier lifestyle. Eat even more vegetables, right? Drink even more good water, right? Breathe good air, be less stressed. You can do more of that. do as much as you possibly can,
Yeah.
right? So going for a scan won't change
a
anything.
thing. Yeah, it won't change what you are already doing.
Yeah, so if you have cancer that metastasized, you won't, if you're not going to do chemotherapy or surgery, there's nothing new that you just breathe more fresh air.
Yeah.
Eat even more good vegetables. So then save the money and buy your organic carrots, buy an air filter in your house.
Yeah.
Get a good trip to Baguio or Sagada where it's less stressful. You can use your money this way. And of course, for patients who are using Simply Nature protocols, you can up from powder to liquid, right? So Doc, how would you tell if you are going all natural, right? So so if your body feels, if you feel good, or you feel weaker, then that's the decision point.
Yeah, that's the decision point. But again, you feel this way. Now, the question is, if you feel this way, are you open to receiving chemo, or are you open to receiving other types of treatment? So, what does that treatment entail? So, does that treatment need some information on the status of your tumor? If it does, then you probably need the scan. Okay, so because the protocol for the different staging of cancer is different. So if it is stage 4, then we go for a palliative treatment. And it also depends on the decision of the family if you want to be more aggressive. So then we definitely need to see the scan so we can have a baseline on, hey, okay, this is what I'm working with right now. And after this treatment, I want to know if you responded to the treatment. So we have to document a before and after shot. Okay, so we know, okay, this is how much it changed. This did the treatment work? Okay, so those are the things that needs to be answered, and those questions will be answered by the results of the scan.
So Doc, thank you very much. I think today's short but very important episode is so important, and I know for all our viewers out there, I know why it's important, because I have a dad that went through cancer as well, and we meet so many cancer patients. So every centavo counts.
Yeah, of course.
Every centavo counts. Every cent counts. And I've met patients who are so discouraged because they have spent their children's university fund, or because they had to go for treatment. So yeah. I truly understand the worries that people have. But thank you, Dr. Jansen has given us a very clear understanding. The scans are important when you need to make an update or change to your protocol.
Yeah.
So those of us who are going for chemo, who are going for surgery, please don't save money on the scan, right? You save money on the scan, you cut the wrong place.
Yeah.
All right, you save money on the scan, you take too strong a chemotherapy, and you hurt your body. So if you're going for those protocols, please go for your scans. But for those like my dad, so that's no wonder my dad didn't go for any scan. He just like, it's okay. So he went all natural, and the good news is my dad is fine. Ultimately, we did do one more scan after some time, and it's all clear. So praise God, right? So for those who are going completely natural for whatever reason, the good news is you unless your procedure, unless you're going to do some protocol that requires more information, and your doctor will let you know. But if you're just going to follow on your protocol, and if you feel a little bit worse, okay, then it may not be necessary to go for a scan. In fact, you can then invest your funds on getting even better treatment. You can actually upgrade your protocols to use a stronger protocol that will cost more. But that's where your money can go instead of the scan.
Yeah.
But of course, if you're a cancer patient and you get pneumonia, then you need to go for
the scans, the X-rays.
Then you need to go for X-rays and things like that. All right, but that's so helpful. So today, again, if you have any other questions that you want to ask Doc, if you're after listening to his advice, you're pretty excited, well, you can consult with Dr. Jansen. Just click on the link below, and please give us your feedback and comments Okay, yeah, we'll love to, Dr. Jansen will love to answer your questions and have you consult. And so thank you, everyone.
Thank you, everyone.
There we have it. So at this point, questions are very much welcome. Just type them down in the comment section below. Kahit Tagalog, okay lang po. But just before we go to our AMA or Ask Me Anything portion, keep the questions coming in. Quickly, I just want to greet our avid viewers. Helen Camonayan, Glenn's Regala, Joy Cabrera, joining from Santa Rosa, Laguna, Flordelina Durpan, and Miss Amelia Rivera. Okay. And I would also like to greet our new viewers, Nelia Mohicadiro, Weng Carino, Christian J, hello po sir, Pearly Peñaverde, and Jocelyn Tolentino. Good evening and welcome to the program. Now, to answer all your questions in this modern world filled with noise of different health opinions, only trust the ones from the experts. May I call on Mr. Shyan Lim and Dr. Jansen Kalalan.
Hi, Jen. Good evening, Jen. Hi, Doc. Good to see you, Doc.
Hi. Good to see you too. Hello, everyone.
I just heard from my wife we have an appointment to have coffee together.
Yeah.
Sometime.
Yes.
Okay, looking forward to that, Doc. All right, Jen, let's start.
Okay, I can see lots of questions coming up and thrown privately. So let us start the live AMA or Ask Me Anything portion. First question coming from Mante family. Which kind of PPARS should I take to lessen the tumor or kill the cancer cells?
The best bet would be PPARS liquid. Yeah, should be PPARS liquid. Yeah. So the dosing for that is 1 vial once a day. Okay.
Yeah, that's the highest concentration.
Yeah,
And
Doc gave
then-
you the golden bullet.
Okay, next
best.
question from Dolly Kalubad. Hi, good eve. I have two friends who have breast cancer. One is 15 years survivor and the other
Oh,
is
this is a
20
good
years
question.
survivor. They both eat anything like meat and etc. Why can they eat anything and yet cancer free?
Okay. Very good question, no? But this is something that is how should I say? Unique. Yeah. Because if you look at the population, no, the population level, when if you are a cancer survivor and then you eat anything, no, like you eat lots of animal food products, processed foods, no, chances are the cancer will come back, and your survival rate is shorter. Okay, or yeah, survival rate is less. Okay, however, it's not just simply eating meat per se. You have to consider the other foods that the person is eating as well. So if the person is eating a plant predominant diet, then yeah, in combination with probably good genetics, no, if they really take good care of themselves, depending on their age as well, then yeah, they might be able to survive this long, which is quite good. This is the goal for everybody, right? Surviving, still living 20, 30 years after getting a cancer diagnosis. This is what everyone wants. Now, another consideration is the treatment. Were they able to finish the treatment or not? Because if you are able to complete the treatment, depending also on when you got at what stage of cancer you got treated, okay, the earlier it is, the better, the higher the chances of survival. Okay, so you have to also take into consideration that one. So just to give you a general idea, no, if you got diagnosed with stage 1, stage 0, stage 1 cancer, then you got treated immediately, especially if you underwent surgery, chances are I won't be surprised if you live this long. Okay, but if you are on stage 2, stage 3, the chances of surviving this long is gonna be less, way less. More so for stage 4 breast cancer patients. You'll be surprised. Some cancer patients who were diagnosed with stage 4, no, are still gonna be alive after 5 years, which is kind of pretty long already, considering that they were at stage 4 already when they got treated. Okay, but more often than not, there are also a lot of cancer patients on stage 4 who die, no, even when they get treated, because it's already stage 4. Okay, so no matter what you do, no matter what kind of oncologic treatment you will have, okay, whether it be conventional surgery or non-conventional, no, the earlier that you get treated, the better it will be for you.
Okay.
Yeah, and I just want to say also, you notice that how shall we say, my wife can eat more than me, but she doesn't get fat. It's so frustrating, doc. I eat a little bit and I put on weight so quickly. Wait, so I don't mean to make light of this topic, but here it is, right? So Doc Johnson has shared a very good insight. Many times we see someone enjoying something we wish we also were able to do, right? But the truth is there's a lot of other factors that come into play. So we may be looking at the wrong reasons why this person lived for 15 or 20 years and is no reoccurrence. Okay, so let's take something totally different, right? Totally different. Have you ever met like a 27-year-old and a very successful businessman? Then we say, wow, this person's so gifted, right? He do business for 5 years and then he's so successful. Well, in my field, I've actually interviewed, and many of my friends are very successful business people. I can share with you, I've not met a person who has built an established business who hasn't done business for more than 10 years. But I've met people at the age of 25 already have established businesses. The reason is when they were 15 years old, they already start buying and selling and starting businesses. So if you just look at a person and say, wow, how do you succeed in business when you're only 25 years old? The answer is actually, they don't. They started when they was 15 years old. So same for this example of cancer. I just hope that a totally different example might help you understand the real reason why your friend is able to live 15 years and 20 years cancer-free after beating their first round of cancer is not because they eat everything. Doc Jansen, we have a mutual friend, right? The one that leads a cancer, how shall we say, chat group on Facebook that you gave a talk on, right? She was almost cancer-free, right, Doc? And then she just ate a few inner south chicken.
Yeah. I think it was Jollibee. Yeah, fried chicken,
Jollibee, and
fast
then
food.
she
Yeah.
knew it was just the chicken, and then everything started to come back. And then when she stopped, right, she was back on the road to recovery. So here's a very good example. You don't want that risk, right? Maybe you are the lucky person, with the right genetics and the right background that you can eat whatever. But here's the question: what if you are not? Then you are playing with your life, right? So the general guidelines that we share is for everyone, right? The general guideline that we share is the highest chance of success in general for every person, which is to eat a plant-based food and avoid as much dairy and meat as possible if you're a cancer patient.
All right. Moving on to the next question from Weng Carino. Hi, Doc. Is it safe to have 3 consecutive CT scans in less than 2 weeks? One CT is with contrast but in different parts. Naman.
It's generally safe if it is warranted, no? However, here's the thing. The number of scans that us doctors request, no? Of course, we are aware that there is risk of radiation exposure, but the radiation exposure to scans is quite minimal. Usually, the average that you can take in a year would be around 5 to 7, sometimes 10, depending on the part of the body, no? Now, if you are undergoing CT scans this frequent, no, this means that your doctors are trying to monitor something, they're trying to look into something, they're trying to find out something in your body to give you treatment. So at this time, the benefit outweighs the risks involved with the CT scan. Okay? So if I were in your place, I would want to undergo the CT scan, even if it's this frequent. Yeah, because I want to get treated for my other problem. Okay? So you would want to find the solution to your problem now versus a problem in the future, or rather than trying to prevent a problem in the future that might not even occur at all. Okay, I hope you understand understood what I meant, no? With that statement.
You know, Doc, as you shared during the discussion, and I hope every one of our viewers learned tonight, right? When a doctor sends you for a diagnostic, a scan, there is a reason that there is an answer they're trying to look for. That means they suspect something. So they ask you to go for a scan to confirm whether it's left or right, so that they know which way to go. Now, sometimes as patients, you may not know how to ask your doctor, Doc, why are you making me go 3 scans? Did you make a mistake the first 2 times? That's why you asked me to go for the third. All right. Sometimes we don't feel brave enough to ask our doctor. We may have some fears. So I want to share with you one additional reason why you can go for a consult with Dr. Jansen. Okay. Doc, sometimes if you don't know how to communicate with your doctor, because, and I understand why, not all doctors are talented as teachers. They are very good doctors, but they may not be very good teachers, right? They may not be very good at explaining to you. So you can always arrange for a consult with Dr. Jansen to understand what you're going through, so that he will look at the reports and then he'll say, you know what? Okay, this is what you ask your doctor. Doc, you sent me for this scan. Is it because for this or this or this? That is also something that you can ask Dr. Jansen for consult for. Doc, I don't know. Suddenly I made you from doctor to lecturer. So, but you know, that is sometimes what we can go and ask we can have a, that's why teleconsult is so wonderful, right? You don't have to go for traffic and then wait 3 hours in the queue to see Dr. Jansen to ask him about your diagnostics. You can just set a time and very quickly in 15 minutes or 10 minutes, get your answers so that you can go to your doctor more confidently, knowing what to ask, so that you will be very comfortable with your treatment.
Yes, so for those of you who wish to have a consult with Doc Jansen Kalalan, the link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialist, Miss Beth and Miss Irish, will reach out to you shortly. And then next question is the question of all women in the world, from Miss Joy, representing, does wearing bra can cause breast cancer?
Oh,
No.
what an interesting question, but
No,
I
no,
think
no.
it's important to ask, right? You have, because you wear that every day.
No, no, no. Nowhere in the medical guidelines, or nowhere in Google or the third-party researches that that says no, wearing bra causes cancer. No. The risk factors for cancer are the risk factors for developing breast cancer are totally different. Yeah, so it's not, wearing a bra is not one of them. But of course, you would want to wear something comfortable, right? So yeah.
Okay, I hope that's clear for all of us. Next question from Nelia Mohicadiro. Is it safe to have a yearly plain CT scan of the chest?
Okay, here's the thing, no. Remember what I said a while ago? Your doctor's requesting for the CT scan, no matter how frequent it is, no matter how much the number of CT scans the doctors are requesting for, they would always want to find something, okay, that would influence their medical decision making, their treatment options that they are considering for you. Okay, so if you are someone who's very healthy, no sickness at all, okay, undergoing a CT scan once a year, the risk will now outweigh the benefits. Okay, because you're exposing
Wow.
yourself to unwanted radiation. Okay, so at this point, no, it's a no-no. Now, here's to put this into perspective. Okay, we're going to go a little bit technical here. So the amount of radiation that a person can receive is measured in millisieverts. Millisieverts. So that is a small m followed by capital S and a small d. Okay, millisieverts. For the general public, for the general population, no, and for teenagers, the limit for radiation exposure is 1 millisievert per year. Okay, that's
Wow.
for the general public. General public. Okay, for occupational limit, okay, of radiation exposure is 50 millisieverts a year. 50. Okay, this is for people who are working in healthcare facilities like doctors, nurses, rad techs. Those who are working in power stations, nuclear power plants, etc. It's 50 millisieverts, no? Now, one scan of scan or CT scan will give you approximately 5 to 7 millisieverts, depending on what part of the body that is being scanned. For your head, it's gonna be lower. It's like 2 millisieverts. But for the chest, it's gonna be 7 millisieverts. So you see um the perspective. Okay. So if you are someone who's perfectly healthy, then exposing yourself to 5 millisieverts, 7 millisieverts, where in your limit is just 1 millisievert a year, then that's gonna be, risks are gonna be outweighing the benefit. There are other modalities, other tools that you can utilize to screen for illnesses, to screen for diseases. Okay. Now, for someone who's sick, okay, then the 5 millisievert, 7 millisievert exposure is justified because we have to address a problem now. Okay?
Okay.
So I hope you understand where I'm coming from. No, this is what's going on in a doctor's mind always when a doctor is trying to decide to recommend CT scan or not to you. Okay? Yeah.
So, Doc, follow up with this question. I think the viewer is one of those, how shall we say, proactive persons.
Yes.
Prevention is better than cure. So, I'm sure this person, if it's a guy, he will not hesitate to go for his prostate exam. Yeah, he will be very willing to go. But so, Doc, along this line, so X-rays and CT scans, they actually have a risk. So, I want to ask, are there actually like diagnostics that actually have close to zero risk? Like, for example, going for CBC, complete blood count, blood tests. No matter how much we do, those are actually okay, right? What about ultrasound? Yeah. What are some of the diagnostics that we don't have to worry that you can't overdose on these diagnostics? Yeah.
Yeah, I mean, you've mentioned ultrasound already. There's no radiation involving ultrasound. I mean, ultrasound is just sound. Okay.
So it's safe,
So it's safe. I mean, the machine is
Ah.
basically detecting echoes, no?
Okay,
So there's no risk
that's one.
involved. Yeah, no risk involved there. Yeah, your blood tests, so they extract blood from you. Yeah, the
That's
worst that can happen is yeah,
bruises.
a bruise. Yeah, bruises. That's the worst that can happen, no? What else? What else? What other scans?
Everything else
MRIs.
uses radiation. And MRIs. Oh, okay, that's good. Good to know.
Yeah.
So MRIs are
MRIs.
one of the things that hospitals specialists often ask you to go for. So MRIs are magnetic resonance. So it's also safe.
Yeah, perfectly
It's also
safe.
unless you have unless you have a pacemaker.
Yes, correct. Correct. If you have a pacemaker or anything metallic inside your body, then you're not gonna be cleared for MRI in the first place, no? The only other thing that's gonna be, relative contraindication for you to undergo MRI is if you are claustrophobic. You're afraid of tight spaces. Then yeah, most likely you're not gonna be able to survive being scanned with an MRI because an MRI scan can take around 20 to 40 minutes per scan, no? And yeah, no radiation involved there, by the way. Okay.
And I think this answer, Jhen, one of our viewers' question was asking, is ultrasound safe? So for the viewer, you got your answer. All right, and MRI as well.
That answers the question of Delia Lorenzo. What is the max number of PET CT scan a cancer patient can undergo in a year? And then the Marites Kalinao, how about ultrasound and mammogram? Is it carcinogenic? If a person have breast cyst, is it necessary to do both mammo and ultrasound? Yeah.
Yeah, very good
that's
question.
interesting.
For
Mammogram
for breast,
used to be, mammogram does have a radiation risk, right?
yes, because that's X-ray. Yeah. So we have to put this into context again, no, depending on the age of the patient as well. Depending also on the family history. So if the patient is, say, for example, 25 years old, the patient's family, one of the family members have breast cancer, diagnosed with breast cancer, especially first degree relatives, no? Also, if they underwent for genetic testing and they have a BRCA1 mutation, BRCA mutation. Okay, so if so, then mammogram, breast ultrasound at age 25 would be justified because you would want to catch these cancers early on, and these are the women who usually develop breast cancer at a very young age, usually either in their late 20s or in their early 30s, they develop breast cancer already. Okay, so yeah, another one is for mammograms. For if your risk is if your risk is very low, no, say for example you don't have any family history of breast cancer, then undergoing a yearly mammogram at age 40 would be good. If you have one first degree relative who developed breast cancer but BRCA1, BRCA2 is not known, 35 years old would be good. Or you can, or as a rule of thumb, no, you can start screening 10 years earlier than the age when the cancer was diagnosed at that family member. Okay, so that's how you can go for your screenings.
Okay, thank you,
Uh,
Doc.
Doc, I want to read one of the replies from one of your patients. So Ms. Glenn's Regala says, I agree with you, Session and Doc Jan. She agrees with me. She says, Doc Jansen really makes time to answer her mom's questions and her concerns during their consult with you. He says that you don't hesitate. She says that if you are a patient, you won't hesitate asking Doc Jansen questions because he explains it so well.
Thank you, thank you, thank you.
So she said that you, Dr. Tapia, and Simply Nature was heaven sent. So she's thanking all of us. So for Ms. Glantz, thank you very much for your kind words. It's a great encouragement to us for us to continue to be patient and to keep on doing this. Thank you.
Oh, thank you, ma'am. Okay, she actually has a question from Miss Glenn's Regala. If nuclear imaging costs 15K to 20K, how come it is not prominently used by doctors? Most prefer CT scan, and between the two, which is better? Which is less on health risk?
It depends on what you want to look at or what you want to find out. Okay. So here's I'll simplify it this way. If you want to look at the anatomy of the body, then CT scan is better. Okay.
That means you want to look at the organs. You want to look at
you want to
organs.
look at organs. You want to look at the structure, size, location. Are there any abnormalities going on there? You would want to use a CT scan. Okay. If you want to know function, whether or not a cell, function. Whether or not a body part is metabolically active, is it function, no? Just basically function, then you would want a nuclear imaging test. Okay, I'll give you an example.
Okay.
Yeah. Okay. So, for example, a patient. So this is something that in real life, no. So, a patient comes to me, a breast cancer patient, complaining of back pain. Now, how would I know if that back pain is something sinister like a bone metastasis or arthritis? Yeah, how would you know, right? So, one way for us to know, no, is to request for a CT scan. Okay, we would want to know if there are any lesions in the bones at all, because back pains can be like arthritic pain, no, it can manifest the same as bone metastasis. So on CT scan, if we see something there that okay, we have these lesions, on CT scan, then automatically okay, this might be something this might be a metastasis already. However, it doesn't end there, because if it is metastasis, then these are cancer cells that attach to the bone. So you would also want to know if these cancer cells are active or metabolically active. Okay, so you would want to request for a bone scintigraphy scan. This is a bone scan, no? A bone scan is a nuclear imaging scan. So they let you drink something radioactive, upon drinking the radioactive material, that radioactive substance will home to that part of your bone where it is highly metabolic. So when you get a scan, that will light up. Okay. Now, if the nuclear imaging scan, okay, the areas of your bones that lit up coincides with the areas of the bone on the CT scan that has lesions, then that would further confirm the diagnosis of, hey, you might have something like a bone metastasis. Okay, so when do we not consider bone metastasis in this case? No, so for example, again, patient comes to you, known case of breast cancer. Patient complains of back pain. Okay, on bone scan, um, the lesion lit up. It lit up. Okay. However, on CT scan, it did not. It does not have any lesion. The bones does not have any lesions. Then that is most likely something arthritic. So it's something degenerative rather than cancer or malignant. Okay, so that is how we try to delineate which is which. So these are very important tests. No? So this will actually determine what kind of treatment your doctor will give you. Okay, because if you are someone who has bone metastasis, then automatically that would be chemotherapy. You would have to be given with zoledronic acid. Probably if you're hormone receptor sensitive, no, you would have to be given hormone therapy. Okay, but if it's not malignant, it's not a bone metastasis, it's just arthritic pain, then simple pain relievers would work. Okay, so that's how we know for sure which kind of treatment we would be recommending based on the test results. So it's not just because this one is better or the other one is not accurate or less accurate, then we would gravitate towards using one specific modality. It's not that, no. It depends on what we want to find out. Yeah.
So Doc, it's thank you for explaining that. Now we are more confident why our doctor choose more expensive or for some people it's the reverse, Doc. Some people say, I want to use the most expensive scan. There are people who are like that, right? Because give me the best scan. I want to spend the money because I'm afraid of my health. So it's almost like, actually, if you go to doctors are professionals. So it's like when you go to a steakhouse, they have a special steak knife for you. If you're eating at home, the knife that you use to cut beef or chicken is all the same. But when you go to a restaurant, right, the knife that you use to cut fish and eat a steak, they actually give you specific one for the function. So it's the same for your diagnostics. So Doc, thank you for explaining to us. Now at least we know the difference between nuclear imaging and PET scans and CT scans.
Okay, moving on to next question from Christian J. Doc, is there any specific fish we can take if cancer patient?
Okay, this is in general. If you're a cancer patient, you should not be eating any food that is sourced from animals. That includes fish. Okay, so all kinds of fish is excluded from your diet. The main reason is because of glutamine. So glutamine is an amino acid that is very rich in animal food products. And cancer cells love glutamine. So cancer cells not only love sugar, okay, they also consume cholesterol and this specific amino acid, glutamine. Okay, that's why we tend to advise cancer patients to avoid these animal food products, no? If they are diagnosed with cancer. Now, there will be exception to the rules. Okay, there will be exceptions. If you are a cancer patient who is very, very thin already, then that's the time I will allow you to eat animal food products. Okay. However, there is a way on how we can mitigate the absorption of glutamine by cancer cells. That's by using medications like loratadine and green tea. Okay, but there's still a but there. Okay, but yeah, that would be for consults already. So because I cannot just give these medications, ask patients to take these medications left and right, no? Especially loratadine. Although loratadine is an antihistamine that is over the counter. Okay, it's still a medication, still a drug. Okay, so there you have it, right?
Yeah.
No, I wanted to also add when it comes to fish. Dr. Jansen explained that you should avoid animal products when you actually eat, what should I say, when you are a cancer patient. Now, in the event that for even the rest of us, in the event that you are going to eat fish, maybe I will tell you what is the worst thing that you can do. Okay, number one, if you take a very common fish like bangus is cultured. That means it's mass grown they use a lot of antibiotics and growth hormones. So those imagine growth hormones. It makes your cancer grow faster, right? So this is the reason why commercialized fish is not a good idea. Okay, and so the next thing is fish without scales, like your catfish. You call it hipon, is it? Is it hipon? Hito, all right, hito.
Hipon is shrimp.
prawns.
Yes.
Yeah, shrimp. Okay. Yeah, like hito. Fish without scales, they actually absorb heavy metals and pollution even more. Okay, so eating those type of fish is even more dangerous. So that includes, for those who love Japanese food, that includes your eels, unagi, right? It includes your unagi. So these are seafoods that and of course shellfish, because it has the word fish in there, right? I just covered. So shellfish like oysters and all that, they are the bottom feeders of the ocean. So they really take in all the dirt and toxins. So these are really not ideal, especially if you're a cancer patient. And even if you're healthy, really eat it in moderation.
Okay,
Jhen?
I think that also answers the question of Miss Rowena Cruz at Campos. What kind of foods do you suggest for a cancer patient? Okay, next.
Plant-based.
Okay, next question from Jen Chan Ang. Hello, Doc. What type of blood test is the most accurate tumor marker? Thank you.
That would be okay. Before, I would have answered you. There's no blood test that is accurate, no, as a tumor marker. The most accurate one is PSA. Okay, because PSA, with its name, no, prostate specific antigen, that molecule is unique to the prostate. Okay. However, even if the PSA is elevated, doesn't necessarily mean that a person has prostate cancer already. Okay. Now, um, after that conversation of ours with Gene Solution, now my answers
Yes.
has changed. No, the most the type of blood test that is the most accurate tumor marker is your liquid biopsy. Yeah, because that test looks into circulating tumor DNA. Yeah. Okay. So that is even more accurate. No, not really accurate, no. That is even more that test can even detect cancer earlier than imaging studies. Okay, so that would be again liquid biopsy.
There you
Yeah,
have
that is
it.
a very interesting ongoing development. Doc, I just wanted to share something I saw on news today. So to everyone, I'm sorry, it's just an interesting, how shall we say, segue. This was actually on a finance program, right? So the person was actually talking about investing. And one of the panelists is actually an investor, an avid investor in the aging industry. So he says that in the next 5 years, there will be products that will be coming out that would already extend life. That is very interesting. That increase your lifespan. So specific products that you inject into your body, and it will actually increase your expected life expectancy. And he brought it up because he says, if you are young now, maybe you're 20, 30 years old, or maybe like Doc, like yourself, there is a possibility that before you hit 60, there might be developments that will push your age past the 100-year mark. And that affects the time scale when it comes to planning your finances. So I just thought that was very interesting. So I bring this up because I'm just trying to encourage everybody. There is good reason to really put effort to change your lifestyle, because you might be able to live a long time, and you don't want to live long and be sick, You want to be able to live long and be healthy and be mobile and to be energetic. So I hope that encourages you to take care of your health. Because who knows, 15 years from now, they may have an injection that will increase your lifespan by 5 years. So sayang if you're unhealthy.
Mm. Oh, more
Yeah.
questions about the liquid biopsy. On what specimen?
The cancer
Blood.
itself, the cancer. Liquid biopsy is done via blood. However, it doesn't end there, no. The the lab would need a tissue block from. They would need the sample from your tumor. It's from the tumor itself. Once they get the sample, then the monitoring, the succeeding monitoring would just be blood, just 10 ml of blood. Yeah, but the first test, no, the first test that you would have to, that you will undergo, they need the tissue block or the tissue sample. Okay. Yeah.
Okay. More question about biopsy. What do we mean by frozen biopsy?
I think that's frozen section. What they do is when after the during the surgery, no, they get the tumor. Once they get the tumor, they send it to the laboratory. Then they flash freeze it with liquid nitrogen. Then they slice it. Okay, they slice it into very thin pieces. Then they look at it under the microscope. Then that's the time the pathologist will read, no, whether or not what you have is cancer or something else, no. If you have cancer, then that's the time that they will grade the cancer as well. Okay, then they will now inform the surgeon, hey, this is the findings of the sample that you sent us. Then the surgeon will now be able to make a decision on what kind of surgery he would have to perform. Would a lumpectomy be enough? Would a mastectomy be enough? Or would the surgeon would need to dissect the axillary lymph nodes, the lymph nodes found in your armpit? Okay, so that's the decision making that is usually that usually happens, no, intra-op, okay, during the surgery. Okay, so that's frozen section. If that is what you meant by frozen biopsy.
Okay, thank you, Doc. Next question from Sally Obejas. Good evening po, Doc. My question is, I have bone CT scan last month. Then in my L3 vertebrae, there's a possible bone metastasis. Then my oncologist told me to go zoledronic acid. She told me to do it monthly. And is this considered stage 4? And is Zometa brand good?
This is what I meant a while ago, no? So, if you underwent a CT scan with suspected, with this kind of suspicion, most likely you have bone metastasis because there is something abnormal already on the CT scan. If you undergo a bone scintigraphy scan, it might light up. So now your onco is suggesting for you to have zoledronic acid injections. The main purpose for that is to build your bones. It's to prevent, no, not really prevent the cancer from eating up the bones, no. It will eat it up anyway, but the zoledronic acid will help build your bones. It will help make your bones stronger. This is to prevent compression fractures or stress fractures, no, that can result because of the presence of the cancer cells in the bone. Yeah. So Zometa brand, is it good? I don't personally prescribe zoledronic, but among my cancer patients, Zometa is one of the most frequently prescribed by oncos. So yeah, I think the brand is good considering the amount of oncos that prescribe it that I encounter. Okay.
Okay, thank you, Doc. We're almost at the end of the webinar. Last 3 questions left. First from Han Yuri. I had my core needle biopsy last April 29. The result is benign. But my doc told me it's malignant. So he wants to repeat it with excision biopsy. Now I'm having double thoughts. Is being an experienced oncologist can easily tell if the mass is malignant just by touching? I'm worried.
Yes, the answer is a resounding yes. Okay. The core needle biopsy is not 100%. Okay, you know why? If the sample that they got is something, if they were not able to hit the part of the tumor that is cancerous, then of course the reading in the biopsy will be benign. Okay, so they would have to get another sample to confirm if you really have cancer. But based on the appearance, based on the signs and symptoms, okay, if you're okay, so some symptoms of breast cancer, no, if you have nipple discharge, if you have nipple retraction, if the skin of your breast looks like an orange peel, okay, if the size of the mass is if the shape of the mass is irregular, so it's not perfectly round, there are some parts that is more rounder than the other, okay, that's a sign of malignancy. If it's really hard, so how hard is it? Put your pinky and your thumb together, then try to peel this. If that is that hard, then chances are it is malignant or it is cancer. Also another one, if the scan tells the doctor that it is cancer as well, the BIRADS category, okay, of your mammogram, if it tells the surgeon that it is cancer, then yeah. If I am the surgeon who got this kind of result, I would repeat the biopsy again. But I will not get I would not do a core needle biopsy anymore. I would rather get an excision biopsy. I would rather get the whole thing, look at the whole thing to see if it is cancer or not. Okay? Yeah. So pray that pray that your surgeon is wrong, no, that it is really benign. Okay? But you have to undergo the excision biopsy. That is the only way to know for sure if it is benign or not. Okay? And if it is malignant, at least you already had it removed.
Oh, okay. Thank you so much, Doc.
Yeah, Jen, go on.
Sorry. Okay. Next question from Ramelin de Golacion o Gabang. Doc, good evening. My husband has a recurrent tongue cancer and we're already taking PPARS. My question is, what product that we need to intake to gain protein?
Doc.
Okay. Yeah. For protein intake, especially for elderly, no. So this advice not only goes to the husband of Ma'am Ramilin, no, but this also goes to all elderly patients out there who doesn't have cancer or who has cancer, especially those who are really, really thin. Okay. If you are so, then you have to take in a lot of protein. Now, some products, no, that you can look into for your protein intake is plant-based Ensure. So Ensure is a meal replacement product, okay? But you have to go for the plant-based version, okay? You can also look into healthy options, plant-based protein powder. That's also a good product to go for. What else? You can also look into LAC. LAC's brand of plant-based protein. They also have a plant-based protein powder available. Yeah, so those are some of the products that you can look into. Okay, yeah.
Okay, last question for tonight from YouTube. From Miss Rose Chan. If I am presently undergoing chemotherapy, can I take PPARS? Is it right after chemo or will wait for several days to take PPARS? And is it okay not to tell my oncologist that I'm going to take PPARS?
Okay, Doc.
Okay. I'll answer the first question. I'll leave Shan for the second
Okay.
one.
All right.
Okay. It depends on what kind of chemotherapy that you're taking. Usually, well, this is just for me, no. There are a lot of doctors who uses PPARS as an adjunct treatment for cancer, but this is just me, okay? I don't usually advise patients to take PPARS together with their chemo or on the same day, at least on the same day, no, because chemotherapy is oxidative, so meaning it generates free radicals to kill the cancer cells, no, aside from it being toxic to cancer cells itself, okay? So PPARS is a product that has very good antioxidant properties. So if you take them together, there is a chance that the chemotherapy will eradicate the antioxidant of the PPARS first. Yeah, so you will get the benefit of the PPARS by doing so. So what I advise patients is to at least take the PPARS 24 hours after receiving the chemotherapy. But this is only true for certain chemotherapeutic drugs. There are other chemotherapeutic drugs that you can take PPARS together, okay? And it will actually even enhance the effect. Also, one such chemotherapy drug is capecitabine or Seloda, okay? So there are others. There are others, but I would have to know what kind of chemotherapy drugs that you're taking to answer you for sure. Okay. So yeah, that's my answer to you. So if you are, you know, quite unsure on what to do and you have the product already on hand, here's what I would do, no. So if the chemotherapy is being given IV intravenously, then wait 24 hours after they pulled out the IV line. So for example, the IV line was disconnected at 4 p.m. in the afternoon. Then wait for 24 hours. So 4 p.m. on the next day, that's the time that you can take the PPARS already. So that's how I would do it if you're really unsure and you would not want to go for a consult. Okay. Yeah. So the second question, whether or not you should inform your onco about this, I leave it to Shan. I think Shan has a very good perspective on this.
Okay. My answer is most uncles will tell you not to take any supplements. Okay. Don't be angry with them, and also don't just shut down. Don't just accept that answer as well. I think very important in today's day and age, and you have so much information and programs like ours where you can ask questions. All right. So the reason why your uncle will tell you not to take any supplements is because your uncle doesn't know every supplement that's out there in the market. So he will choose the safe option, which is to tell you not to take anything in case it might have contraindications with your chemotherapy. Now, this is the reason why on our programs, we will answer your questions. Dr. Jansen is a full medical doctor who actually specializes in cancer care. He has dealt with many cancer patients, and he deals with cancer patients that use chemotherapy, radiation therapy. So to give you confidence about your decision, to make your decision, there's a big difference between anyone who advises you to take any supplements. And if you ask them, I'm taking this particular chemotherapy drug, and they give you a blank look, and they say, oh, it's safe. Well, that's why uncles will tell you don't take supplements, because the people introducing to you supplements for your cancer care doesn't even know the chemotherapy drugs, doesn't even know how chemotherapy works. So when they say that it's safe for you to use together with chemotherapy, how do you trust them, right? But as you can see on our program, we have Dr. Jimmy Katapia, SMX Live person to person. We have Dr. Jansen Kalalan. We have all these doctors who actually know chemotherapy, know surgery, know all these things. That's why they're able to answer you. Okay, so but don't blame your uncle because he may not know Dr. Jansen. All right, he may not know that you talk to Dr. Jansen and that you know what you're doing. Okay, so that's why in general. So it is still up to you. It is still up to you. One thing you can do is that if your uncle is in the Philippines, then you can always drop a message to Simply Nature. We actually have medical representatives that will go and meet your doctor, right? We are always looking for new doctors to work with, and we will have our team explain to your doctor how our protocol works. So I've actually presented to hundreds of doctors over the years. I just presented at the Davao Regional Medical Center, and some of the attending doctors include top doctors from St. Luke's Hospital, both from BGC and Quezon City. So I've also presented to hospitals for example, in Bacolod, I think it's called River Valley Cancer Center, presented to their uncles. So all these doctors that I present to, almost all of them are interested because we provide the evidence base. They're interested to learn more. And then many of them actually start working with us and prescribing products for their cancer chemotherapy patients. All right. So I think you have many options, right? You can make your own decision. If you're not sure, make a consult with Dr. Jansen. Then he'll confirm with you, okay, you're taking this chemotherapy drug. This is how you use the product together with it. Okay. Yeah. And if you want us to talk to your uncle, give us the number and we'll send a med rep to go and talk to your uncle so that, so all these options are available to you.
Okay,
Yeah.
I'm afraid that's all we've got time for today. So if you have any follow-up questions, don't worry, we will answer each of your questions next webinar or via direct message. But just before we say goodbye, kindly give our viewers your parting words for tonight.
Doc Jan.
Okay.
Doc Jansen,
Yeah.
you go first.
Yeah. So I want to thank all of you, for asking all these very interesting questions. Even though we've done this for how many years already? 3 years.
3
It's
years.
always the
Episode
questions are always
161.
wow. Wow,
And what?
161, huh?
61.
161.
Wow.
Wow. So yeah, it's the questions are always unique. I
Yeah.
haven't encountered questions that were repeated though, unless it's all about unless it's about nutrition.
Yeah,
but
then
usually
what
it's
should I eat for cancer?
yeah. It's the only thing that is being repeated. But outside of that, it's really unique. Each question is unique each week. Yeah, this is really wonderful. So I hope you continue to attend these webinars, no, continue to watch, and please share this program to your loved ones, to your friends, no, so that we can help more people. Yeah. So thank you, everyone. So that would be it for me. So I'll give the floor to Shen.
Yeah, same for me, Doc. We've been doing it for 3 years. I thought by now we would be exhausted or maybe bored with always talking about cancer every single Thursday, right? But no, it has been interesting. Even on days when Doc Jansen is tired, I can tell, or when I'm tired, when we start going into the questions, we get engaged. And it's really very rewarding for us, One of the things I really want to thank everybody is you actually ask very specific questions. Many times that you viewers will ask us, I'm taking this chemotherapy drug, so I'm very glad that we can actually help to answer your questions and give you some clarity in how you're going about your cancer journey. So, Doc, we have another person shout out. This person says, Dr. Katapia is my uncle. He says hi to Dr. Katapia. Yeah, Dr. Katapia is one of the most kind and warm doctors that I know. And, we've referred many patients to him, and they have always said good things. So once again, thank you, everyone. I hope to see you on Thursday. If this session tonight has been beneficial to you, I just want to encourage you that when you go for a consult with Dr. Jansen, he is just as guapo as you see him now. And he is just as friendly, patient, and kind when he does his consult with you. And of course, please share with your friends and family so that they can find answers on their journey against cancer. Well, good night, everybody. See you guys next week.
Thank you, Doc. Thank you, Sir Shyan. We hope to see you again in our future webinars to come, same day, same time, every Thursday night at 7:30 p.m. For next week, we will discover the latest cancer treatments using immune checkpoint inhibitors. But for tonight is the last day of Lazada 5/5 Super Sulit Tipid Sale. So check out participating items like PPARS tablets, PPARS Plus, and PPARS extract soft gel capsule for prevention of cancer recurrence. Up to 24% off from the official Lazada Mall of Simply Nature. But wait, there's more. It's a back-to-back Lazada Sulit Sweldo sale next week from May 13 Monday until May 17 Friday. Yan. And lastly, this July 27 Saturday, we are calling again all cancer patients, survivors, and advocates. Let's all come together to beat the odds using medical nutrition, oncology, surgery, and PPARS in fighting cancer. This seminar isn't just about learning, it's about empowerment. Because every health journey is unique, but you are never alone, and together we are stronger than cancer. So thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we're always with you from start to healing. Thank you, everyone. Good night, and God bless you all.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself. How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's not enhancing.
Now you know, cancer eats what? Cholesterol, right? Simply Nature people can lower what? Cholesterol. Now you understand why you are taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening, right?
Especially if we are talking about solid tumors. The number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, plus very honest sila sa mga questions, sa mga pagsagot sa mga questions. Tapos nasasayahan ako, ganun.
We're always with you from start